All right, everyone, it is 12 noon here in Colorado. So I would like to thank you and welcome you to our 8th lecture in our Enhancing Wellness for Healthcare Professionals Through Engagement with the Arts lecture series. My name is Catherine Reed. I am an art therapist here at Children's Hospital Colorado. And I am part of the Choral team, and Choral is the Colorado Resilience and Arts Lab. And we are hosting this lecture series this year with a charge from our funders, the National Endowment of the Arts, to really serve as a bridge between the healthcare community and the arts community to both enhance, establish, and inspire these relationships and partnerships across the state and even across the country with this lecture series. In fact, the exciting thing about today is that we are going international with our lecture series. So we are welcoming Dr. Jess Bone. She is a research fellow in epidemiology and statistics in the Research Department of Behavioral Science and Health in London, at the University College of London. She's currently working in their Epi Arts Lab, a collaboration between the UCL, the University College London, and the University of Florida Center for Arts, which is also funded by the National Endowment of the Arts. Also Bloomberg Philanthropies and the Pabst Steinmetz Foundation. Dr. Bone will be talking to us today about her work that aims to understand the population level public health benefits of the arts by exploring associations between arts and cultural engagement and then longitudinal health outcomes in the US cohort studies. So we're really excited to have Dr. Jess Bones here with us today. Jess Bone, I'm going to actually be calling her Jess. And I am going to hand it over to her. Welcome. Also, before I do that, I want to remind everyone that as you listen to her presentation, if you develop questions that you would like to ask her personally, we will have a question and answer session at the end of the lecture. In fact, that'll be in about 35-40 minutes. And so anytime during her lecture, you can put your question into the question and answer section on this Zoom call. Don't use the chat, use the question and answer section. And after she's completed her presentation, we will be having a conversation, she and I, using your questions. So please know that we want to hear from you. We're thrilled that you're here. And Jess, take it from here. Thanks so much for being with us.
Brilliant, thank you. So thanks for the introduction and thank you for having me. Just gonna get my slides up. Can you see those okay? Yeah, brilliant. So, yeah, hi everyone. As Catherine just said, today I'll be talking about research we've been doing exploring the impacts of arts and cultural engagement on population health outcomes. So, first, I wanted to start by kind of speaking briefly about the different approaches to research on arts and cultural engagement. So we can divide research methodologies into kind of 3 main approaches, which I've put on the slide here. So we have basic science, applied science, and population science. So whilst basic and applied science methodologies are really important and really useful for understanding whether kind of these relationships exist, they are kind of limited in what they can tell us. So, for example, say you're interested in whether being part of a choir might help to reduce depression. We could start by doing a small survey or a qualitative study where we ask people who are part of a choir whether they think that it helps them to kind of manage their symptoms. We could then run a randomized controlled trial where we recruit a group of people with depression and we randomize them to either attend a choir or to get some kind of control intervention, such as like treatment as usual, for example. And we can measure their depressive symptoms before and after attending the choir and see whether this choir had a larger effect on their symptoms compared to their kind of treatment as usual. But these approaches often use quite small samples, which means that they can only detect often relatively large effects. And we often find there's a certain kind of person that is willing to take part in these studies. So their findings often aren't generalizable to the whole population. And these studies are also quite often limited with very short follow-up periods. So we can't see the kind of long-term effects that being part of a choir might have on the individuals. And then another limitation that we need to think about is that actually not everyone might want to join this choir. What if they'd rather be part of, say, a dance group or a book club instead? So this is where we think our work, which is kind of at the population level, is really important. So we use data from cohort studies, which include large samples that are representative of the population of the US. And if these studies follow these participants for many years. So the data is observational, which means we don't kind of manipulate or change anything. People are just asked about their kind of everyday lives. But this allows us to investigate everyday engagement in the arts and to understand how many people are participating in arts activities. So going back to my example, in these studies, we could kind of first explore how many people in the US are attending choirs. And then we could say, okay, for those who have depression, does being part of a choir reduce their symptoms? And then we can also extend that even further and look at, say, whether being part of a choir can prevent them developing depression in the first place. Or we could look at other types of art engagement, like book clubs or, other kind of dance or literally anything that people are engaging in. And that might be better for those people who are not interested in being part of a choir. So as you can see, there's a huge range of questions that we can ask of this kind of data. And the great thing is that we have these really large samples that are representative of the US population. So asking these kind of questions is what we're trying to do in the Epi Arts Lab. So as I kind of said, we're exploring the impacts of arts and cultural engagement on population level health and wellbeing. So we're also an NEA lab, and as has been said, it's a kind of collaboration between the Center for Arts and Medicine at University of Florida and UCL, where I'm based. And we have kind of three main questions that have been guiding our research. So firstly, are there associations between arts engagement and mental health and wellbeing? Secondly, is arts engagement associated with increased health promoting behaviours? So things like exercise and drinking less. And finally, is engaging in the arts associated with improved physical health, such as diseases like diabetes or age-related decline? So to do this work, we've identified a kind of range of US cohort studies that have already collected data on both arts and cultural engagement and a wide range of health outcomes. And I'm going to be focusing on the first of these questions today, so summarising our findings to date on mental health and wellbeing. But before we kind of got started on looking at whether arts engagement is associated with kind of population health, we wanted to first understand who actually engages in the arts in the US and explore the characteristics that make people more likely to take part in different arts and cultural activities. And I think this is really interesting and provides quite a good context for the rest of the research. So I'm going to talk through these findings first. And this study has been published in BMC Public Health, if you do want to kind of read it or reference it in any of your work. So in order to look at who engages in the arts in the US, we use data from the General Social Survey. And this is a repeated cross-sectional survey, and it includes a really large sample, which is representative of all adults in the US. And I'm not going to go into all the details here, but we included about 8,700 people in the study. And as you can see across the top of the slide, we looked at 4 different types of arts and cultural engagement. So the first was receptive cultural activities, and that includes things like attending a music, theatre or dance performance, an art exhibit or a museum. In contrast, the arts activities, the next one along, were things like making art or craft objects, taking part in music, dance, or theatrical performances, or playing a musical instrument. And then we have creative groups, which were kind of hobby or garden clubs, or literary, art, or discussion groups. And then finally, we have the fourth column, which is a bit different, which is interest in cultural activities. So that's people who hadn't been to things like the theatre or a museum in the last year, but were actually interested in doing so. So we found that overall, about half of the sample did a receptive cultural activity, and again, about half did a participatory art activity. And then another third said that they were interested in doing the cultural activities, but hadn't been able to. And then only about a fifth, so fewer people, said that they were part of creative groups. And then our next step was to look at a whole range of factors and see whether they were associated with doing each of these activities. So the ones that were kind of significantly associated are shown on the left of the slide. So as you can see, being female, being white, never having married, and having more education and more parental education as well were pretty consistently associated with increases in all the types of arts engagement. So those people were more likely to have done all of the activities. But a lot of the other socioeconomic factors, so things like higher income, higher social class, poorer health, living in a more rural area and living in a larger household, were all associated with the receptive cultural engagement. So things like going to the theatre or going to art galleries. But these factors weren't associated with the other types of engagement or with being interested in the cultural activities. So we think that this suggests that arts activities and creative groups might be kind of participated in by a more diverse audience. And we thought that this might be because they're more widely available potentially, or cheaper to participate in. And they often don't require getting to a specific venue, which may not be accessible to everyone. But another thing that I think is really important to note is that these kind of predictors of arts engagement are really similar to the inequalities that we see in access to healthcare and health outcomes as well. And this might be because arts engagement is just kind of correlated with health, and they're both a form of kind of capital. But actually, we think that arts engagement is a health behaviour, and it leads to improved health outcomes. And this actually makes the lack of equity in participation really quite concerning. And it also has really important implications for our research, because clearly there's a social gradient in arts engagement, and we need to consider that all these kind of social factors might affect both arts engagement and health outcomes. So this can cause confounding in our research, where it looks like arts engagement is associated with better health, but actually the associations we see are just a result of these social factors. So that brings me on to the kind of key question for our work, which is arts and cultural engagement associated with population health outcomes after accounting for this social gradient? So obviously this is a really broad field, and there's so much literature that it's impossible for me to cover all of it today. But I want to focus on a few studies that we've done in the Epi Arts Lab over the last year. So I'm going to keep it pretty high level, just give you an overview of the work we've been doing, but hopefully we'll have plenty of time for questions after I finish. So if you want me to come back to any of these studies in any more detail, please do just say after I've finished. So the first piece of research I want to talk about explores whether engagement in a range of different leisure activities is associated with reductions in depression for older adults. And I think this is a really important place to start because of the aging population in the US, and also just how common depression is among these kind of older adults. So this paper is under review at the moment, but a preprint is available if you want to have a read of it. So for the study, we use data from the Health and Retirement Study, which follows a group of older adults in the US every 2 years. And we included just over 19,000 participants, and we had 2 waves of data for every participant. So in this study, we wanted to look at whether a kind of diverse range of leisure activities might reduce depression. And these activities were chosen because they kind of differ in how much creativity they might involve, as well as whether they're likely to be kind of social or involve exercise or physical activity. So the activities we included are listed on the left of the figure on the slide. And we used kind of population averaged panel data models. And we looked at whether doing these activities monthly or weekly, compared to not doing them at all, was associated with a lower likelihood of someone meeting the criteria for depression. So we adjusted these models for a wide range of confounders, including all of those factors that I was just talking about that are really important for these associations. And this plot here shows the main results from our first model. And basically the dashed line up the middle of the figure indicates where there's kind of no evidence for an association. And the horizontal lines are the confidence intervals. So basically where these horizontal lines don't cross one, we can then say there's significant evidence for an association. So we can see here that in this model, only doing hobbies and taking part in clubs were associated with depression. So doing a hobby was associated with about 20% lower odds of having depression, whereas being part of a social sport or other kind of club was associated with between 15 and 22% lower odds of depression. And the odds were kind of lowest for those who took part most frequently. So the more often you went to a club, the less likely you were to have depression. And we then extended this analysis to look at whether these associations were kind of maintained longitudinally. So we wanted to ask, after accounting for previous levels of depression, when participants did these activities, was there evidence that kind of more engagement was still associated with lower depression measured 2 years later? So you can see here that the kind of overall evidence for hobbies and clubs was really quite similar. So as well as kind of being associated with lower depression at the same time point, doing these activities is also associated with lower rates of depression 2 years later. And there was also some additional kind of evidence in this model. So we found that baking or cooking every week was associated with lower odds of depression, and also attending non-religious organizations. So that also seemed to reduce people's odds of depression. And you might have noticed that the other arts activities, so things like reading, writing, and sewing, weren't associated with depression in this study, which was actually quite unexpected. We thought that they would be. But overall, we found the kind of strongest evidence that doing hobbies and being part of a sport, social, or other club was associated with lower depression, both concurrently and 2 years later. And we think that this might be because these activities kind of provide opportunities for cognitive stimulation, for creative expression, potentially opportunities for socializing and exercise as well, among other things. So now I want to move on to another of our studies, also in older adults, which uses much broader outcomes. So this explores whether arts engagement is associated with different types of well-being. And this is also under review, this paper, and available as a preprint as well. So as in the previous study, we used data from the health and retirement study again, and this analysis included about 12,000 adults from one wave of the HRS study. So we used a kind of really recent addition to the questionnaire, which asked participants about whether they've participated in a community arts group in the last month. And this is a kind of different definition of arts engagement to in the previous study, and kind of narrower, more sort of traditionally arts-based, because it included things like choirs, dance, photography, theatre, or music groups. So it's any kind of community arts group. And we used a kind of different approach to our analyses in these studies. And the approach is called propensity score matching, which I don't want to go into detail because it gets very complicated. But essentially, it attempts to simulate a randomized controlled trial. So the aim is to create two groups of really similar individuals and therefore remove the influence of factors that are associated with arts engagement. So basically what we do is we estimate a score for each participant that indicates how likely they are to participate in a community arts group. And that score is based on their characteristics. So things like age, gender, race, household income, and so on. And then we use this score to match people who did participate in the community groups with those who did not. So this means that the two groups should be really similar on the levels of all the included socio-demographic factors. So that aims to remove confounding by those factors and get at a more kind of causal analysis. So what we wanted to do is tap into the kind of multidimensional nature of well-being, because we think that kind of reflects the range of different priorities for kind of aging healthily. And you can see along the bottom of the graph here that we had 6 different outcomes. So they were satisfaction with life, experiences of positive and negative affect. So that's kind of feeling enthusiastic and enjoying activities versus kind of feeling more distressed or fearful. And then the 3 outcomes on the far right of the graph are all sort of subtypes of eudaimonic well-being, which consists of kind of finding meaning in life and flourishing. So we have purpose in life, and then we also have constraints and mastery, which kind of both relate to people's beliefs that they're able to achieve their goals, with constraints focusing on the kind of negative obstacles and mastery focusing more on people's kind of abilities to achieve their goals. So what the graph shows is the kind of standardized increase in each type of well-being that results from participating in a community arts group. So what you can see shown on the graph is the stars indicate the kind of significant associations. So we found that participating in a community arts group is associated with increases in life satisfaction, in positive affect, purpose in life, and also with mastery, but not with negative affect or with constraints. So from this, we think that participating in a community arts group is associated with the kind of more positive elements of well-being. So it's likely to help promote healthy aging in older adults, even if it doesn't lead to reductions in the more kind of negative aspects of well-being. So now I want to do a big jump from one end of the life course to the other and focus on a couple of studies in young people instead. So adolescence is the period from the start of puberty to people gaining an independent adult role. And it's a really important time for health. So we know that 75% of mental health problems have their onset in adolescence. So it's a really key period for us to try and prevent or reduce these issues. And the first analysis I want to look at is assessing externalizing behaviors. So these include kind of conduct problems, so things like getting angry and fighting and lying, and also hyperactivity, which is things like being restless, fidgety, and easily distracted. And you might have heard before the kind of contrast between externalizing and internalizing disorders, where internalizing is things more like depression, anxiety, and more kind of emotional experiences. So this is kind of the opposite of that. And these behaviors might occur kind of in response to adverse experiences or other problems in people's lives. And they are associated with a kind of range of long-term negative outcomes. So there's been quite a lot of interventions based on the arts that have been used to kind of target externalizing behaviors, but we don't really know yet whether everyday engagement in the arts can reduce these kinds of behavior. So in this study, we use data from another cohort, which is called the Early Childhood Longitudinal Study, and we included about 8,500 adolescents. And we looked at whether a range of measures of arts engagement in 5th grade were associated with externalizing behaviors in 8th grade. So the first of our measures of arts engagement was extracurricular arts activities. And that includes dance, music, and art lessons, as well as organized performing arts programs. And on this graph here, you can see that doing more of these kind of extracurricular arts activities was associated with a lower score, so with fewer externalizing behaviors. And that effect size was kind of larger, so the estimate was further from this line of kind of no effect before adjusting for all the confounders. But once we added those in, so in this second line down in the adjusted model, you can see that there's still evidence for this association. So even after adjusting for things like socioeconomic status, gender, age, all those kinds of things, taking part in more extracurricular arts activities was associated with fewer externalizing behaviors 3 years later. And then in the study, we also included 2 other measures of the arts, but these weren't associated with externalizing behavior. But these arts measures were, firstly, the number of in-school arts classes, and secondly, the adequacy of arts facilities at the adolescent schools. So I think that it's maybe not that surprising that those weren't associated with the adolescent's own behavior 3 years later, because it's likely that although they might have had more arts classes available in school, that doesn't necessarily mean that they're kind of engaging with them or, actually enjoying them or taking part. So I think it's likely that the level of engagement a child kind of actively has with the arts, so kind of actively creating or developing new skills, that is probably what's driving this association with the externalizing behaviors. So simply having the classes kind of on offer at school or having kind of more facilities may not actually be enough to influence outcomes for the adolescents. And then finally, I want to mention some more kind of social outcomes. So the importance of social relationships for health is really, really widely recognized. And adolescents and young adults, I think, are kind of at particular risk of feeling lonely and lacking social support. This is a really important period for the development of social relationships, and adolescents kind of rely increasingly on their friends as they get older. So loneliness is defined as a kind of subjective negative feeling that arises from a mismatch between people's desired level of meaningful social relationships and what they actually think that they have. So it is separate from, but also really strongly related to, perceived social support. So perceived social support refers to people's beliefs about the quantity and quality of support that is potentially available from people's relationships and social contacts. So in this study, we included about 11,000 adolescents from another US-wide cohort study, and that was the National Longitudinal Study of Adolescent to Adult Health, which is kind of commonly referred to as AdHealth. And in this study, we measured the total number of school-based extracurricular activities. So kind of similar to the previous study that I was just talking about, but sort of a bit broader. So it was kind of school-based arts clubs. So things like band, book club, choruses or choirs, cheerleading or dance, drama club, school newspaper, and orchestras as well. So we kind of totaled up the total number of activities that each adolescent participated in at the kind of wave 1 of this study. So that's when the participants were aged between kind of 12 and 21 years. So it was quite a broad range, age range in the sample. And then in the study, loneliness and social support were measured at the same time point and also 1 year later as well. So kind of overall in the study, we found no evidence that the number of extracurricular arts activities engaged in was associated with loneliness. And that was quite surprising to us because we know that there are kind of a lot of arts activities influence health through their kind of influence on social relationships. But we think that this lack of association might have been because of the measure of loneliness that was used in Ad Health. And that was just one question that asked people about how often they felt lonely over the last week. So that might not have been kind of sensitive enough to detect any differences or to kind of delve into what is loneliness and how do adolescents kind of experience it. But in contrast, perceived social support was measured with 8 different items, and this was associated with arts engagement. So we found that adolescents who did more extracurricular arts activities reported higher levels of social support, both at the same time point and also 1 year later. And I think quite importantly, this association was independent of whether they also engaged in other extracurricular activities, so non-arts activities, so things like academic clubs and other kind of school-based clubs. So this suggests that arts activities might provide kind of additional benefits in the school setting on top of other kind of extracurricular clubs. And we think that it might be that they provide additional opportunities for kind of creative expression and self-development, as well as social engagement and developing friendships and potentially building a sense of community in a kind of more relaxed atmosphere than, say, sports clubs, for example. But one thing to note with these analyses is that once we added in previous levels of social support into our model, there was no longer evidence for the association between arts engagement and social support 1 year later. And we think that that's because the levels of social support were quite stable, so they didn't change much over 1 year. But it could also be that it's a bidirectional association. So it might be that adolescents who have more support around them are more likely to take part in these activities. So I think this really needs to be explored further in future research. So before I kind of wind up, I want to reflect a bit on how these findings compare to previous evidence from the UK and Europe, because obviously the US has a really different social, cultural and demographic context to the UK and Europe. And there are lots of differences in funding for and provision of the arts as well. But kind of overall, our findings were definitely in line with existing evidence from the UK and from Europe. So I provided some examples of work done by my broader team on this slide for comparison. So, for example, there is evidence that relatively similar socio-demographic factors are associated with arts engagement in the UK and the US. So things like gender, ethnicity, and income are very similarly associated across the two countries. And there's also been quite a lot of research in the UK showing that the kind of all different types of arts engagement, so kind of receptive cultural engagement, things like going to the theatre and the cinema and museums, as well as hobbies and kind of general creative activities, are associated with lower rates of depression in older adults. And the same also applies for the kind of different aspects of well-being. So I think it's reassuring to see our findings translating across the two different countries and finding really similar evidence for these positive impacts of the arts on health. And in general, there's kind of definitely less work to date that focuses on arts engagement in adolescence, but I think in the work that has been done, the findings are pretty consistent in the UK and with what we've done so far in the US. And we find really that arts engagement is beneficial for a range of outcomes. So in the last half an hour, I've done a real whistle-stop tour of some of the research we've been doing in the FE Arts Lab over the last year. And I've talked about research at both ends of the life course, but obviously this is just a tiny amount of the literature on kind of arts engagement and health. But overall so far in the US, we found that some types of arts engagement are associated with reduced depression and enhanced positive well-being in older adults. And in adolescence, our findings indicate that doing extracurricular arts activities might reduce externalizing behaviors and increase social support as well. And so I think awareness of these findings is really, really important for healthcare professionals, particularly for anyone who's thinking about applying for funding or kind of the implementation of arts interventions. Understanding the kind of broader background and the literature on the kind of population level engagement in these activities, I think is really important. And I also think that more kind of public awareness and sort of understanding about the importance of the arts for health is really vital. And we hope that that might kind of lead to increased participation in the arts in the general public, and also more support for the sector kind of in the long term. I think ultimately we really hope that our work might lead to introducing social prescribing in the US, which has started to happen in the UK, but we're just not at that point in terms of the evidence in the US yet. But basically, social prescribing is where care providers can prescribe directly to arts and social activities. So that can be instead of medication, alongside medication and other therapies, but it means that there is funding available for people to go out and find these kinds of activities and take part in them, as well as support from a healthcare professional, which I think could have great implications for a lot of people. So before I end, I'd just like to thank my collaborators who are shown on this slide. So they are all the other members of the Epi Arts Lab, and we've all worked together to produce all of the work I've kind of run through today. I've also put my contact details on the top right of the slide, so do follow me on Twitter if you'd like updates on any of the papers I've talked about or any other future work from the Epi Arts Lab. And I'm really happy to take questions now, and I'd also be kind of interested in hearing people's views and interpretations of the findings that I've presented today. So a lot of this was really new work, and I know I've gone through it really quickly, so I'm happy to come back to anything that people are interested in. But it's the kind of first time that anyone outside our group has heard about a lot of these findings, so it would be really useful to have people's thoughts and feedback on them as well. So thank you. I'm gonna stop sharing now so you can see Catherine. Oh, you're muted there.
Thank you so much for sharing with us. That was really fascinating research, and how lucky are we to be getting kind of the first view of it. I'm particularly fascinated because I do work in a children's hospital here with children who are struggling with both externalizing behaviors and internalizing depression and suicidality. And I'm curious, we have a couple questions in our question and answer section, and I invite anyone else to join that section with your questions for Dr. Jess. I will be sharing them with her. But first, I wanted to ask, really, how do you see, especially psychiatric hospitals, places like the place I work, being able to capitalize on what you've learned in your research? What kind of message would you want them to hear?
I think the overall message has to be that the arts have a really important role in people's kind of recovery and overall health, and that we should be encouraging families to think about how they can participate, like all of them in the family, not just children, but everyone, to kind of increase general levels of engagement. And also for us as researchers and healthcare professionals ourselves, that we need to be thinking about incorporating these things into our lives and making sure that we are kind of living these fulfilling life. But I think also this kind of population level research is really important to show that these associations do exist, and we can draw on this evidence to then kind of implement more targeted interventions in healthcare settings. So I would hope that it would lead towards kind of getting more funding for the arts in these settings, which I know is always a struggle.
Absolutely. I think that's one of the reasons I'm so fascinated by your work, because of the range, the broadness of your reach. I mean, having a 12,000 person sample is pretty amazing compared to the research we're doing is much more targeted and smaller, and I mean, it can go quite deep. Actually, we're doing 12-week workshops with Coral and inviting healthcare professionals in. So it's very much focused on building resilience and also really trying to prevent burnout in general. So thinking about the time that we're in and kind of the duration of the COVID pandemic and the general longitudinal fatigue that healthcare professionals are experiencing, it's a really interesting time to be doing this kind of research, because not only are we learning about how the arts can help create a sense of purpose or renew that sense of purpose, but also we're able to study it, right? So it's almost having a clinical effect as well as the research longitudinal hopes. So I just really appreciate the perspective of kind of that broad view, and then especially from, I think we've been very focused on the specific health workers we're working with, but then how to really expand that.
I think it's so important to have both approaches. You know, we need this big population level data, but also we really need these really targeted studies to get this much more detailed data as well. And it's only by combining the two that we can really build this proper evidence base.
Beautiful. I agree completely. So I'm just really grateful for you joining us today. I want to share one of the questions that came through, and I'm going to read it to you. It says, when you say who engages in art activities in the United States, is that unique to the US, or are those findings that could be representative of a global population? If not, what distinguishes the US population in this area?
It's a tricky question to kind of drill down into. So obviously a lot of the kind of research that we have on this topic now is all in kind of Western countries. So a lot of the kind of large, you know, population-based research and these cohort studies are in Western countries. So I think that the characteristics associated with engaging in these activities are very similar. I mainly know about the work that's happened in the US and the UK, and there are definitely similarities across the two. I think the differences kind of could be driven in the way that arts are funded. In the UK, there's kind of more kind of centralized government funding for the arts, I think, potentially than in the US. And that could kind of contribute to things being cheaper or kind of more widely available. So there might be kind of fewer sort of socioeconomic differences in the people who participate. But we do find those differences in both the UK and the US. So it is really similar. And things kind of on a broader scale that we need to think about is like, how accessible are the arts in people's communities? But also, I think something that can get forgotten is kind of how are we defining the arts? So the way that these kind of associations we find, for example, race and ethnicity being associated with arts engagement, is that actually that we're just asking about the kinds of arts activities that white people are more likely to attend. So a lot of these activities take place in kind of historically white venues that other people of color might kind of feel more barriers to attending. So actually, if we're just saying, okay, who's going to the theatre and going to these specific like arts museums, then we're not actually looking at kind of overall levels of arts engagement. And that is definitely one weakness of this, this kind of approach to the research using these population studies, is that we're limited by the questions that they've asked. And whilst we're really lucky to get some input into kind of future surveys and the future questions, the data that exists, a lot of it is kind of based on these sort of more like traditional highbrow forms of kind of arts and cultural engagement. And that's something I've been trying to avoid where possible in our work. And that's kind of why at the start I wanted to talk about engagement in these 4 different types of activities. So not just the kind of receptive cultural things like theatres, museums, galleries, but also things like creative groups and kind of arts activities that can be done in the home. But yeah, we need to be really aware of kind of keeping these definitions broad and kind of letting people define what they see as the arts for themselves, rather than kind of forcing definitions onto them.
I appreciate that so much, because it also begs the distinction between public art right? And the accessibility of art that really anyone can be experiencing. And also, I think about how COVID even changed that definition. I think about the DJs who became so important to so many of us as we are sitting in our homes, kind of stuck in our homes. And these are artists who are bringing music into our homes in a communal way that I don't think would have happened without COVID, right? So I do think a lot of these definitions about accessibility will continue to evolve as kind of the global climate shifts.
For sure. And we've
and
actually, oh, sorry, carry on.
no, go ahead.
I was just going to say, we've actually been doing some work just in the last couple of months looking at arts engagement during the pandemic, and we've got some data on that. And I didn't have time to go through it today, and it's kind of really early days in terms of writing that up. But we have found some really kind of interesting and promising findings that in terms of kind of home-based arts activities that people could do right at the start of the pandemic, when all these kind of stay-at-home directives came into play, that actually it looks like there were fewer kind of socioeconomic factors associated with engagement in those activities. So it actually looks like more people might have been able to access them and to do them in the home than they were before the pandemic, which is obviously great if that's the case. And that kind of begs the question of how can we maintain that after the pandemic?
Mm-hmm.
How can we ensure those kind of diverse audiences are able to continue accessing the arts?
Right. And then also how do we continue to define accessibility? Right. And how people can access them, whether it's the internet or literally public art in the streets or I think about all the things, and Broadway just reopening on in New York City, right? Mm-hmm. And those dancers have been so creative in the last year and a half of how to maintain their own mental, physical health without their venues being open. Dancers, performers of all kinds. Mm-hmm. So it's really fascinating to think about all the ways that things have changed in a year and a half. And I'm excited that your research is catching those things. Okay, I am going to read another question that has come through. What kinds of non-religious organizations did you include in your study?
Good question. So these were, I'm just going to have a look. These were kind of like political groups or kind of other sort of community groups. It could have been like a parent-teacher association, these kind of things. So not, probably not kind of arts groups, because it's kind of more organizations. Like it was specified kind of separately to clubs. So in my mind, it was open to interpretation by participants, but in my mind, it was probably more kind of formal groups. And I think that might be why there was kind of less of an association with depression, mm-hmm. that actually they're not kind of as sort of social or kind of creative as groups go. So it's quite different kind of being part of, a running club to being part of like a political group.
Absolutely. Example. Okay, so this one is a multiple question. So I'll just read a couple of them. Okay. Can you explain some of the examples? And I'm excited that this participant asked this question because I'm also very curious about it. Some examples of artistic prescriptions to patients. What does that look like? Is it direct involvement in an activity like creative expression, or is it more along the lines of attending a museum or concert, or both?
So, really, it's social prescribing is all about like what the individual themselves wants. So it should be kind of focused on what they're interested in doing. But often it does really try and make use of the kind of local community resources. And often there are kind of people in place who are sort of experts on what's going on in the community, who are able to kind of refer out to those activities and kind of signposts. So I think people would be encouraged to do something that's a kind of social activity or in a kind of group situation if they felt comfortable with that. Mm-hmm. So things like, joining, it could be like a gardening club. There might be like a community garden nearby that they could go and volunteer at. Volunteering somewhere else could be like finding a choir or a dance group, or it could even be something like going to the gym, for example, if people are really struggling to get out of the house and they want to try and exercise more. So it should be really kind of individualized. And obviously that's sort of dependent on the resources that are available in the local area. You know, people who are living in, say, more deprived or more rural areas where there might be kind of fewer resources accessible, is then kind of even more important that we're finding the right activities to link those people up with. And they're really the people that social prescribing should be kind of targeting the most.
I really feel like social prescribing is challenging the Western medical model of having a pathology and then a solution to it, primarily, you know, historically being medical or medicinal. And that we're really trying to broaden the concept of what is well-being, right? What is health, mental, emotional, physical, and what are the components of that? So I feel like it's challenging our entire philosophical base around health and well-being, of how we're encouraging each other, whether we are doctors, whether we are healthcare professionals, or whether we are citizens, to maintain that health and then to seek it out. Because so much of this, I believe, is forgetting, right? Kind of the philosophical construct of human beings forgetting that art keeps us alive, keeps us healthy. So it sounds like there's so much about value, and how much do we value the arts, both as a society, but also as a medical, in the medical model, right? Anyway, I just kind of went all over, but it feels so important.
I completely agree. It's so important.
So I'm going to read the rest of this person's question. How does that look, social prescribing, insofar as the amount of time devoted to the activity? Are there patients who are optimal candidates for responding well to these types of interventions?
So in terms of like the evidence for it, although it's like really gaining popularity and it even has kind of NHS funding in the UK, like allocated to social prescribing, there's actually really not that much evidence on it yet. So in terms of working out actually the, you know, optimal kind of, we could call it dosage, it's not the right word, but you know, how often people should be going to activities and the kind of people who it might work best for, we don't really know yet. I think that we've still got a lot to work out, but I think that people obviously need to be kind of open to it, to trying things, and they might need kind of help and encouragement with that. And that's something that we need to think about. And there's been kind of feasibility work done with kind of range of different groups, but including, I worked on a study where we developed kind of one of these, like it was essentially a social prescribing intervention for people with like really quite complex depression and anxiety, and people who had been unwell for quite a long time. And they required quite a lot of support, some of them, to kind of work out what it was that they wanted to do and to kind of manage to go along to those groups or activities. But we did see a kind of positive impact, and in interviews people said that they really enjoyed it and it was a great experience. So I think it's just working out, kind of tailoring it to each individual and working out what works best for who.
I am really looking forward to that evidence coming out of the UK, because I think we have a lot to learn about that here in the States. I think there's so much correlation between creativity and mental illness. And there's been lots of exciting and interesting study on that over the years. But, you know, the opposite of that being really, how does creativity and the arts really contribute to mental wellness versus mental illness? It's a giant question, and it's been really fun exploring it with you. So thank you so much, Dr. Jess.
Yeah, it's been great. Thank you for having me. It's been really good.
So if people want to get in touch with you, you had put your email on the screen earlier.
Yeah.
And then also, if anyone wants to get in touch with Coral and learn about what we're doing in our lecture series in general, or our research as well, feel free to reach out to the email that you got this confirmation on. I'd also like to remind people that we will be having our last lecture of our series next month. No, actually in November 19th, Friday at noon. And we will be presenting our Coral research with all of our both music and art and dance and writing facilitators, really talking about what our research looks like in person. So that'll be an exciting hour, I think we'll spend. So Jess Bone, thank you so much for gracing us with your research and your knowledge. And I hope that you have a beautiful weekend.
Thank you. Thank you for having me.
Thank you, everyone. Bye-bye.